This is Dr. Drew Hall with Upper Cervical Healthcare, Los Angeles and Carson. Today what we're going to talk about is Blair Upper Cervical X-ray analysis. This video is for the analytical person that wants to understand what is it that a Blair Upper Cervical Chiropractor looks at on X-ray, which determines how to correct the patient. So the first picture that is taken in the upper cervical work is the base posterior. And basically what this is looking at is the bottom of the head. And so right here you see the C1, and this is C2 in the middle of it, and there's a joint here on the right and there's a joint here on the left, and what we're concerned with is we want to know how is that joint built, the longitudinal axis of it. On this particular model, C1 is turned in about like this on that right joint, and the left joint is turned in about like this. Now the reason this is important is every person is built differently. These joints can be as much as 35 degrees difference from left and right on the same person, and they can be anywhere from straight forward to turned in at 40 to 50 degrees depending on how that person's built. So it's paramount in knowing how they're built, because later in our X-ray procedure what we do is we use these angles to take a picture down to see how the outer margin of the joint between C1 and the head actually fit. So here's what the base posterior looks like. We go through a pretty extensive X-ray analysis to come up with these angles that Dr. Blair came up with. And again, these long lines you see here, that's the long axis of the joint on the right and the left. And again, as different as we all look on the outside is how different we all are on the inside. Now hold that thought, remember these angles, because I'm going to talk about them again here in a second. So one of the other x-rays that we take is a lateral x-ray. This is a picture that's actually taken from the side. And so on this particular individual, here's the back of the head, here's the back molars, the front of the head is over here, the back of the head is over here, and this interesting looking vertebra right here, that is C1. This is C2, this is C3, C4, C5, C6, C7. There's 7 bones in the neck. The atlas is basically a ring. That's why it looks different than the others. But on this particular individual, what's happened is all of the neck has basically lost all of the normal curve. The neck is completely straight, and it shouldn't be straight. The neck should not be straight like that. It should have a C-shaped curve like this. Now, the reason 70% of the people come into our office with a straight neck like that, when they sustain an injury at the base of the skull, remember the head weighs 10 to 13 pounds and C1 weighs about 2 ounces. And when you have a football injury, when you have a car accident, when you get dropped on your head wrestling, fall out of a tree forward off the diaper changing rack, whatever the case may be, this vertebra right here dislodges out of its normal range of motion. It gets locked under the head. It impacts the nervous system, and the first thing that happens is the muscles through the neck go into spasm, and it pulls the neck straight. Now the reason this is critical and has such an impact on health is when you lose the neck curve, remember you have a spinal cord that's fitting in here, right? The brainstem comes right down through here and here, and it fills this space right in here. Now when you lose the neck curve, basically the spinal cord has tensile stress. You have one end of the rope, I have the other, we're pulling on it. When you lose neck curve, that's basically what happens to the spinal cord, and that has a global effect on function in the body. And of course our goal is to find out exactly how that vertebra is misaligned so we can fix it so you can do better. So this particular x-ray, 1, we're looking at your anatomy. 2, we're looking at how are the joints. This right here is a joint between 4th and 5th cervical, and you can see another one here and another one here and another one here. There's 2 on both sides of each vertebra. We look individually at each of those joints to see how, number 1, what's the angulation of it, right? This joint's built like this. Some people are like this. We want to know how you're built and how you are out of alignment. But we aren't going to get into detail about that. Here's what I want to show you. Here is a picture that's taken directly down that first picture we talked about. We talked about those 2 angles. So on the right C1, there's an angle here. This picture is now taken in this plane right down the long axis of the joint. And right here where I'm going to highlight is the joint. Right here is our interest. That is the joint between the head and C1. Let me blow this up here so you can see what we're looking at. And what we want to know is how are those joints fitting together. Now, I'm gonna outline right here, coming down this line we're coming up right now. That is the surface of the joint of C1, and then there's an arcuate shape right here. Is the margin of the right here is the edge of the skull joint right here. And then you can see another white line coming up here, and then you see a corner right here. This corner right here should be even with this corner right here. And again, this block of bone here is C1, and this is the skull. These two margins should be even. This vertebra has literally shifted up the joint plane in that direction, that magnitude, which is quite a bit. This is a way larger misalignment than we see on the average person. But we want to know exactly how that joint is built. We want to know how it's misaligned, so we can then introduce a force very precisely down this joint plane to unlock the vertebra and put it back under the body's control. And then what we want to do is we want it to stay there as long as possible so it can stabilize. And as long as that pressure is off the brainstem, the body's going to go through a healing and recovery process. And our job over time is to run objective neurological tests that test, is this joint locked? Has it returned back to its bad position, or is it still in position? Now that is the right joint. We're going to now go over to the left joint. I already marked this one out, but we're gonna, so here you go again. This dark area is the space between the skull and C1, and I'll mark that out for you. Now again, there's the corner of the joint. This is the left joint. The one we just looked at is the right joint. This corner right here should be even with this corner. On this one, it didn't go off this way, it went under. So, and I'm not going to get into this too much, but basically what this tells us is your C1 has shifted off to the right side. And we'll use all these angles and all these misalignment patterns to introduce a very precise force into that segment to fix it, so you can heal and repair and become the person you're supposed to be. Anyway, I hope that made sense and illuminates or puts some clarity into what a Blair upper cervical doctor looks at on x-ray and how we determine how to fix you.